Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Please subscribe to our Scripps Health YouTube channel. We've got great videos featuring the latest technology, our stellar doctors, and inspiring patient stories. Okay, you're sick. You've got a fever. What do? Take a pill. Got pain? Take a pill. Have trouble sleeping? Take a pill. What do you do in these cases? Let us know in the comments section below. What if there was a different way to treat what ails you? Joining us to talk about that different way is Dr. Chris Suhar. He is an integrative cardiologist and medical director of the Scripps Center for Integrative Medicine in La Jolla, California. Dr. Suhar, thanks so much for being with us. Okay, let's start off with the basics. What is integrative medicine?
Integrative medicine is basically incorporating all therapeutic approaches to help a patient reach optimal health and healing. It's a combination of both traditional Western allopathic medicine, what I've been trained to do in medical school, but bringing in more Eastern philosophies, more Eastern therapeutic options. That could be supplements, herbs, but also different healing modalities, as well as a real profound focus on lifestyle intervention, really looking at how lifestyle plays a role in a person's health.
So what diseases do you treat?
Pretty much anything related to chronic disease. I mean, myself specifically, I'm a cardiologist that has been integrative trained, but we also within the field of integrative medicine, you take hypertension, cholesterol issues, cancer, fatigue, various issues related to women's health, sleep issues. Any of those areas could be wrapped into integrative medicine. Pain, GI issues,
diabetes.
Pretty much, yeah, it's really the field of medicine.
And this is actually very personal for you because you kind of started down this path when your dad was getting treatment in Ohio.
Mm-hmm. Yeah, my father's health is really what got me into integrative medicine. When he was a young man, I was just a baby. He got diagnosed with terminal lung cancer, given 6 months to live. He ended up beating that 10 years later. Then I go into medicine, and I'm a resident in medicine, and he died from adult onset diabetes at age 61. What didn't make sense to me at that point was he beat a disease that he was told he was going to die from, and then there was a disease that he developed, diabetes, that I believe is manageable at least, or if not beatable, and he died from that. And he was taking 19 different medicines at the time when he died, and all the physicians that he worked with tended to do was just add another pill to treat this ailment or this side effect, and I was left very empty. I was left lost in the field of medicine. Here I was, a budding resident in medicine, learning all these great techniques and therapies, and I felt like medicine had let him down. And I searched for a different approach, an approach that I felt really looked at a patient from kind of a more holistic approach.
So what is that mind, body, spirit connection?
Well, the emotional and mental aspect of healing really cannot be separated from the body. The mind, body, spirit is understanding that the stresses in life, your emotions, they play a huge role in illness, but they also play a huge role in wellness and keeping you healing and giving you the opportunity to heal.
Let's talk more about those lifestyle changes in terms of exercise, nutrition, and the way you manage stress, because everybody has stress.
Yeah, lifestyle intervention is the crux of what we do. That's my biggest passion. Every disease that a person can get, or just keeping a person healthy, it comes down to what you're putting in your mouth, what you're doing or not doing for exercise, and the way you're managing your stress. And whether that you learn techniques that keeps that stress from either hurting you or harming you.
So you're an integrative cardiologist. Who else makes up the Scripps Center for Integrative Medicine?
Yeah, so at our center we have 65 employees, which encompasses a lot of different therapeutic options. We have 4 cardiologists. We have 2 integrative pain docs. One is a family med doc that does integrative approaches to headache and various pain issues. We also have an integrative physiatrist or physical medicine and rehab physician who does all integrative approaches to pain. The two of them basically do no narcotics. They do a lot to really impact and reduce pain, eliminate pain, all through non-narcotic approaches. We have a family med doc that specializes in integrative approaches to women's health. And then beyond that, we have nutritionists, we have healing touch therapists, biofeedback therapists, acupuncturists. We have a fully staffed gym, a whole team of nurses and staff that have been trained in integrative approaches. We also have our early detection center, which is a state-of-the-art imaging techniques from echo and ultrasound to nuclear cardiology imaging to PET rubidium stress testing to CT scanning. So it's a whole armament of tools that can really approach patients from a truly integrative approach.
So how does someone come to see you? Is it a referral from their primary care doctor?
Yes, we get referrals from primary care physicians, from specialists. Also, a lot of patients call up and schedule appointments.
So a couple of minutes ago, we basically said, anything that ails you, let's just pop a pill. But you obviously have a different approach. So let's say you have somebody comes in and they've got pain. How would you deal with that?
Yeah, well, first we would try to find the source of the pain and address that source. From a more integrative approach, we would bring in different therapeutic modalities such as acupuncture, biofeedback, massage therapy, cold laser, different modalities that can really help mitigate pain without the use of narcotics.
What about someone who has sleeping problems?
Yeah, well, again, we would try to find the source of their problem, whether it is pain or stress or emotional issues. And we would try to address those issues. Then we'd focus a lot on sleep hygiene. Are they burning the candle at both ends? Are they going to bed early enough? Are they drinking too much fluids in the evening, making them wake up in the middle of the night to go to the bathroom too often? Are they drinking alcohol? Alcohol is a huge source for disrupted sleep. Are they meditating? Could we teach them how to meditate or breathe or use mindfulness techniques or journaling to help them calm themselves, free their mind so they could sleep better at night? Maybe turn off the news and not watch the news in the evenings. Maybe not look at email or screen time right before bed. Those are techniques that really make a huge impact on sleep.
We want you to hold this thought. We're going to come back to this in a couple of minutes. There's lots of research and clinical trials going on now that involve integrative medicine, and Scripps is a big part of that. We'll tell you about that in just a couple of minutes, so hold that thought. What about inflammation? Inflammation is a big deal. What causes it and how do you treat it from an integrative standpoint?
Right, so inflammation is a natural process in the body. It is a process that's necessary and important to heal. Inflammation occurs when there is an injury or a threat to the body, and it's the body's way to try to heal that issue.
Are there foods that cause inflammation?
So yes, your diet plays an integral part in inflammation. If you're eating the wrong foods, it is interpreted as a threat to the body, and you still get that same inflammatory process. So what are those foods? Those are things like red meats, things like saturated and trans fats, fried foods, processed foods, refined sugars. Those are the types of foods that tend to cause an inflammatory response in the body.
So how do you deal with chronic inflammation?
So from an integrative perspective, again, we try to find the source for their inflammation and see if we can help mitigate that source. From a lifestyle intervention, from a dietary perspective, we take a deep dive into their nutrition, look at the foods that are harming them, and then really try to switch and incorporate foods that are really considered anti-inflammatory, actually do the opposite and promote healing. Exercise. When somebody gives up exercise or is not, it does not have time for exercise or is just really not focused on it, their resiliency goes down. Their ability to heal goes down, and their ability to recover from inflammation goes down. And then stress. Again, stress is a threat to the human body, and that gets interpreted as inflammation. So there's a ton of different healing modalities that a person can either learn or participate in that really helps to mitigate that inflammatory response.
So how do you deal with stress? Because everybody has different levels of stress.
Right. Well, so again, like I've said with all of these questions, we first look at the sources. Have an open discussion. I'm not a psychologist or a psychiatrist, but it's really important to me as an integrative cardiologist to bring up what is going on in a person's life from an emotional perspective, and then really try to be open to hearing a person out and giving suggestions. How can we get to the source of really trying to resolve or resolve that stress? Well, what if they can't resolve that stress? What if it's something in their life that's not going away? Well, then it's all about teaching the patient techniques, how to reduce that impact of the stress in their body internally. Can we teach them how to meditate, be more mindful? Can we teach them how to breathe? Can we put them in therapy such as healing touch or acupuncture that really can help the coping mechanisms for those stresses?
Talk a little bit more about the healing therapies. I know that you have there's yoga, Tai Chi, meditation. What else do you offer?
We do mindfulness. We have a mindfulness-based stress reduction program that is one of the best around. We have Tai Chi classes. We do yoga classes. We have nutrition classes.
You've got a vegan cooking course, right?
Yeah, we have a vegan cooking course that teaches people how to cook and eat better. We do sound therapy. We have healing touch, biofeedback, and acupuncture. Those are the big therapies.
Go back and talk about sound therapy. I understand that you offer something called a sound bath.
Yeah.
What is that?
So it's incorporating sounds, instruments, crystal bowls, and it's a meditative technique that uses not only sound but the vibration from sound to really help people heal.
And then there's massage therapy.
Yep.
Also a full gym.
A full state-of-the-art gym.
And what about swim classes?
We have a swimming pool, heated swimming pool. We do master's swim. We just do open swim. We do water aerobics. It's a full functioning gym and swimming pool that has all the traditional classes that a gym would offer.
What about swim therapy?
Yeah, swim therapy. It's great for all kinds of different ailments. Great for pain. People that have troubles walking or using the equipment and cardio equipment in a gym. Get them in a pool. You take the weight off of them. It could be something as simple as water walking. Where they just go back and forth in the shallow end against the resistance of the water. We use different instruments or tools in the pool to help with mobility and resistance. We do swimming just for exercise. Water aerobics for exercise. Get their heart rate up. It's a great therapy for a whole slew of different ailments.
So if you've got pain in your knee from arthritis, or you're coming back from maybe a knee replacement, what you're saying is you can maybe not use as many pain meds, and you can use these water therapy to deal with the pain.
Oh yeah, water therapy is a great way to deal with pain. Can be, and being in a heated pool further helps that.
What is the benefit of all of these healing therapies?
It basically opens the toolbox. It gives me so many different options for a patient. The worst thing I can do is take a patient's hope away. In integrative medicine, we often get patients that are at the end of their rope. They're desperate. They've been told there's nothing else that can be done for them. And we don't accept that. We use these different healing modalities, these different therapeutic approaches that are not considered mainstream, but we consider very effective and very impactful for a person.
So you were trained in Western medicine, and now you incorporate this more holistic approach as well.
Right.
What is the benefit of bringing that East and West philosophies together?
Well, again, it gives me more therapeutic options. It brings in the holistic approach. All too often in medicine, we're siloed. As a cardiologist, I take care of the heart. As a gastroenterologist, I take care of, the gastroenterologist just deals with their stomach. And you can't do that. You can't separate illness. These systems all work together. What the primary care docs are doing or what the various specialists are doing greatly impact what I'm trying to accomplish for a person's heart health. And so the holistic approach is really bringing that all together and understanding it's not just one silo, but it's really all of them that really will help our patients get better or accomplish health.
So we referenced this a couple of minutes ago. Let's come back to this. There's a lot of research and clinical trials going on right now, which involves integrative medicine, and Scripps is a big part of that. Why don't you elaborate on that a little bit more?
Right. Research is paramount to what we do in medicine. Medicine can't move forward without good clinical research. You know, our center, the Scripps Center for Integrative Medicine, embraces that. We really believe, especially in a field where we're doing more, non-traditional approaches, we really want to bring evidence-based research to these approaches. We've done research on our lifestyle intervention programs. We've done we've had a great research project on taking class 2 and 3 heart failure patients and incorporating them in a lifestyle intervention program that really showed improvement in them recovering and feeling better with their heart failure diagnosis. We have ongoing research currently with a syndrome called POTS disease, and we're incorporating yoga with that. We do research on advanced cholesterol management, on obesity management, and on pain management. We're very active in that area.
If somebody wants to get involved in one of those clinical trials, what do they do?
Call our center and say, hey, we're open to participating in research, and we have a research coordinator they would be referred to.
When you incorporate this more holistic approach, is the goal to get the person off of medicine, or is it the goal to get them to reduce the amount of pills that they're taking? What's the goal?
That's actually often a goal for patients. Patients, a really big reason that they'll come to an integrative consultant is saying, hey, I'm tired of taking all these medicines. And so, I hear that, I work with that. My goal is to optimize their health. There are plenty of prescription medications that I find a lot of use in, and I am totally open. Integrative medicine is the best of both worlds. So I'm not necessarily out to reduce and stop every pill if I think there's truly a benefit for them. But I love stopping medicine. I love not starting medicine. I really like to do things as naturally as possible.
Any final thoughts, doctor?
I love what I do. I think integrative medicine is the way all medicine should be practiced. I appreciate that Scripps embraces it. They've helped us create the largest and best functioning Center for Integrative Medicine in the country, and I'm very, very proud of that. I love my job, and I love working here.
Thanks so much, Dr. Suhar. We really appreciate it. If you want more information on the Scripps Center for Integrative Medicine, just click on the link or go to scripps.org/videos. Want more critical information about your health? We take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel or follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.